Right? We were born, we evolved in sunlight. We've always appreciated the beneficial effects of the sun. Now, people worry about who supports you, because you've heard a lot about this, right? Well, I do get support from both NIH and the UV Foundation, but I've had 30 years of support by someone that I'm most appreciative of, and that is the sun, right? And in fact, for those interested, you can go to this website, vitamindhealth.org, for more information on vitamin D. But this has been my problem, because I've been talking about this for almost 40 years, right? People could not think of a more boring subject than vitamin D, right? It was found in cod liver oil, prevented rickets in children. We don't see rickets very commonly. We are not thinking about vitamin D deficiency. So I don't know what she's thinking about, but who is at risk of vitamin D deficiency? And I think you've already heard this, but basically everyone is. Now, coming, of course, from California, Arnold here worried about global warming, right? But he should worry about what is the big deal about vitamin D deficiency. And the big deal, of course, is that D deficiency and rickets is the tip of the iceberg, because as you've heard from many of the speakers already, and I'll talk a little bit more about this disease, osteomalacia, diabetes, multiple sclerosis, rheumatoid arthritis, infectious diseases, heart disease, as well as common cancers have now all been associated with vitamin D deficiency. Now, you may wonder what I was smoking last night, but you've already heard from other speakers that we have good science to back up most of these. In fact, Discover magazine last year, of the top 100 stories, number 8 was, can vitamin D save your life? And Time magazine picked up as the 10 biggest medical breakthroughs, again, more benefits of vitamin D. Vitamin D is a sunshine vitamin, and in fact, I wondered over 30 years ago, when did vitamin D make its first appearance on Earth? And in this bubbling, fertile soup that began life evolving, I wondered whether earliest life forms were taking advantage of the beneficial of the sun, i.e. making vitamin D. And so I asked this question, and I went to my boss, because I was being recruited at the time at Mass General, and I said, I needed a phytoplankton biology lab. And anybody in the audience has ever been recruited, and you're on this honeymoon period, and they're willing to offer you the world. So I was told, no problem, we'll give you a phytoplankton biology lab. So I thought I would show you the sophistication that provided me at Mass General Hospital. Didn't work quite as I had hoped. So we went to Woods Hole. It's a very well-known facility, and we grew an organism that's existed in the Atlantic Ocean for 750 million years, and it's a Euliani huxleyi. And this organism, when we exposed it to sunlight, made vitamin D. So vitamin D is probably one of the oldest hormones on this earth. Why? Well, you might argue, of course, from evolution, if you think about it. Right? That we needed vitamin D for the evolution of the vertebrate skeleton. Well, not quite, because the ocean was a high calcium bath, so you could simply suck the calcium out of your bath and put it back into your skeleton. But 350 million years ago, life forms became bored with the ocean, and they left on for terra firma. And they were confronted with a problem. And the problem is that there is no calcium on land. And indeed, for reasons that we don't fully understand, it's exposure to sunlight on the skin, permitting the efficient absorption of dietary calcium that led to the evolution of vertebrates on this earth. And they certainly need a lot of calcium for their skeletons. But 65 million years ago, life forms became bored with the ocean, and they left on for terra firma. And they were confronted with a problem. And that problem was that asteroid hit. And it's been argued that the reason the dinosaurs disappeared was it was too cold. They didn't have enough food, the winter around the globe. Well, maybe not. It could have been that vitamin D deficiency got them. And you may think that that's silly, except that guess what organism survived that Holocaust? It was a nocturnal rodent, and nocturnal rodents don't need vitamin D to survive. So now if you put evolution into perspective, and now you get your calcium as well. All right, so whether you're an amphibian, reptile, avian species, lower primate, we've always depended on the sun for our vitamin D requirement. Our hunter-gatherer forefathers certainly did. In fact, our skin pigment was designed specifically for our environment. I always wondered about Neanderthals, how these dark, hairy creatures could have survived in the European latitude. And it turns out that recently their DNA has uncovered the fact that they had a mutation of their melanin gene, that in fact they were Celtic in nature. They only would have been able to survive if in fact they had fair complexion. Now I took my daughter on safari to Kenya in the wintertime, and I figured we'd make some vitamin D and write it off on our taxes as a medical expense. I can tell you it doesn't work. No? Okay? But what I did find was this Samburu warrior, and I realized that his skin pigment was perfectly designed for his environment. And I wondered how I could really get the attention of the audience to compare and contrast. So my gene pigment certainly mutated in order for me to make enough vitamin D at this northern latitude. So sunlight exudes energy, and in fact, how do you make it? When you're exposed to sunlight, the precursor of cholesterol in your epidermis and dermis absorbs ultraviolet B radiation, converting it ultimately to vitamin D3. Now, she's got a lot of worries, a lot of bad habits, but one thing she doesn't have to worry about is, can you make too much vitamin D from excessive exposure to sunlight? And we showed many years ago that any excess vitamin D that's produced in the skin is rapidly destroyed by sunlight. Very clever system, Mother Nature. And so you can never become vitamin D intoxicated from excessive exposure to sunlight. But the question you should really ask is, because people ask this question all the time, if you take a vitamin D supplement, is it identical to making vitamin D in your skin from sun exposure? And my answer is maybe not, because all of these other photoproducts are being made at the same time, and we don't know whether or not they have any biologic function. We're doing research right now to begin to look at that. So for humans, the story begins with the Industrial Revolution. The kids in these alleyways developed classic rickets, growth retardation, and the skeletal abnormalities. It was Holczynski, a Viennese physician in 1919, that was thought to be a nut. He was taking kids, irradiating with a mercury arc lamp, and he demonstrated he could cure rickets. Well, you realize by now that I'm interested in the history of vitamin D, and I wanted to get my hands on the earliest prints of Holczynski. So where do you go? National Library. Nope, they didn't have them. I went to Harvard Library. Nope, they didn't have them. Guess who had them? eBay. So off of eBay, I have the earliest pictures of kids being irradiated, and look at this. I have the x-rays from 1918. You see no mineralization of the carpals, and poor mineralization of the epiphyseal plates. Ultraviolet radiation, 1 hour, twice a week. Marked mineralization after only 6 weeks with restoration of the epiphyseal plates. It was considered to be an infallible cure for rickets. In 1921, some physicians Hess and Unger took some kids, put them on a roof of New York City Hospital, and demonstrated they could cure rickets. This led to a novel concept. In 1931, our government actually set up an agency telling parents to put your kids outside to get some sun exposure to prevent them from getting rickets. But in this day and age, unchallenged for 40 years have been the dermatology societies telling you never to be exposed to direct sunlight. In fact, parents don't know what to do these days, because if you ever put your child outside without a sunscreen, you could wind up on America's Most Wanted for child abuse. Right. It was Steenbach who realized that if you irradiate people and animals, why not irradiate the food? And this led to the Steenbach process of irradiation of food, specifically milk. And then ultimately it was the addition of vitamin D to milk that eradicated rickets as a significant health problem in the United States. And as a result, people forgot about vitamin D in terms of being important for health, because we didn't realize that it had other benefits. And so it was really the eradication of rickets that was very important because it was such a prevalent disease. Now, it turns out bone health, it's essential for bone health, whether you're a rodent or a puppy or a cow or a chicken. They all needed a source. Now, here's Cedric. Unfortunately, I didn't get a good picture of him quite, but he asked me if I had any interesting cases. And I know I have some physicians in the audience, so I thought I would bring you a couple of cases that you may not typically see. Here's a 7-month-old female, muscle weakness, tetanic seizure, serum calcium of 4.2 mg/%. This infant's about to die. And it turns out this infant got a lot of publicity in Boston. It's the first lowland gorilla born in captivity at our zoo. And it turns out that she is about to die. She was seen by the pediatrician, gave 400 units of vitamin D. It didn't do any good, concluded it had a rare genetic disorder of vitamin D resistance, said, good luck, caretaker, nothing we could do for you. Well, it turns out the infant's complaining to mom, and the mom is getting really upset, and the dad is equally distressed because he knows that his daughter's in deep trouble. And so the mom finally told him to call me, which is what they did. And I got to see this infant. And the infant has classic widened epiphyseal plates consistent with rickets. So how do you treat it? And you've heard over and over again about this concept that physicians, pediatricians in particular, are paranoid about giving infants any amount of vitamin D. I gave this infant 5,000 units a day, and in fact, the infant's feeling great. And indeed, I was a guest of honor for her first birthday. Right? But this is the message to the physicians, and that is, Mommy, will my growth be stunted? We believe that vitamin D deficiency during that first year of life could set them up for type 1 diabetes, multiple sclerosis, as well as affect their bone density and bone health for the rest of their lives. That's the message here. Right? In 1889 in Boston, 80% of infants had rickets. So could it be a problem today? You better believe it. And in fact, we see on average a dozen cases a year of rickets, which I consider to really be malpractice. And there's a simple reason for it, because it's suggested that my doctor said breast milk will provide all the nutrition my infant needs. It turns out human breast milk is a poor source of vitamin D, no more than about 25 units per liter. So it turns out that we did a study. I went to our neonatologist. I said, you know what? I bet you your pregnant women are vitamin D deficient. And the immediate response was, Holick, you got vitamin D on the brain. Our women are taking a prenatal vitamin. We are carefully watching them. They can't be vitamin D deficient. Good luck. So I got one of the fellows, and we went ahead and we got 40 mother-infant pairs and got their blood at the time that they gave birth. Sure enough, 70% were taking a multivitamin, drinking 2.3 glasses of milk a day. They were taking 600 units a day. Guess what? 76% of moms, 81% of newborns at the time that they gave birth were vitamin D deficient, right? So we also looked with Lisa Bodner at risk of preeclampsia and vitamin D deficiency, and there is an association. The more deficient you are, the higher is your risk of having preeclampsia. We also know that there's an association with C-sectioning. It was popularized because of rickets. Women had a deformed pelvis, they had a difficult time with childbirthing, so C-section became popular over 150 years ago. So we asked the question, since vitamin D is important for skeletal muscle function and maybe even for uterine muscle function, maybe it's also associated with difficulty at birthing. And sure enough, we'll be reporting in the next month in JCEM that there is a marked association with increased risk of having a C-section if you're a vitamin D deficient. Now, I don't know what Christina here is thinking about, but I'll tell you what, at a minimum, besides that prenatal vitamin, right, and drinking a couple of glasses of milk a day, they should be taking at least an additional 1,000 units of vitamin D a day. How much vitamin D do you need to put enough into human milk? And this gives a real insight, I think, into what humans throughout evolution were requiring on a daily basis. Bruce Holick showed very nicely, if you give lactating women 4,000 to 6,000 units a day, enough vitamin D gets into her milk to provide the infant with all of its vitamin D requirement. So pediatricians, like I said, are really concerned about this issue. And so how much do infants need? No question about it. They need vitamin D at birth. And happily, the American Academy of Pediatrics finally got it right just a couple of weeks ago, where they now are recommending that all infants at the time they're born, throughout the first year of life at least, should be getting 400 units of vitamin D a day. Is it enough? Probably not, but it's a step in the right direction. What about Jurassic syndrome? I don't know if you've heard of this disease, but 750,000 young in the United States at risk every year. Here's a classic case of a 1-year-old female, muscle weakness, bony deformities, and failure to thrive. Well, for the dietitians in the audience, right, lettuce and crickets is not a healthy diet. It's not because of people eating crickets, it's because of iguanas. Because of Jurassic Park, the kids want to have a pet dinosaur, and what better animal to have than an iguana? In fact, 750,000 are reported in the United States every year. They're put on a steady diet of lettuce. There's no calcium or vitamin D. They wind up with osteoporosis and osteomalacia. They fracture their long bones, rib cages, then they fall off their perches, and they die. Well, my 9-year-old daughter went to see Jurassic Park with me, and she wanted a pet iguana. And I know that Cedric keeps up with the literature. And if you keep up with the literature, right here, reptile literature, back in 1997, metabolic bone disease, this is what happens when you're vitamin D deficient. Now, I always like the response from the audience, because whenever I talk to docs about osteoporosis, I show this, nobody cares, right? But this will get your attention, and you won't forget it, right? Right. And you get long bone fractures, right? Okay, so rickets and osteomyelitis, how do you treat it? Just like with our patients. How do you get the patient to take their calcium all the time? I couldn't get this damn iguana to take Tums, couldn't get it to drink milk. No, this iguana is getting low-fat cream cheese in between the lettuce, so it's getting all the calcium it needs. But there is no vitamin D in low-fat cream cheese, so what to do? Well, they like to be outside because they make lots of vitamin D. Well, what do you do in Boston? Well, you go to your local pet shop and buy Reptisun that mimics sunlight so that your pet reptile at home will make vitamin D in its skin. Reptile owners know this. 10 million households in the United States own reptiles, and they all own these Reptisun type lamps for 40 bucks. So there he is smirking at me because I just spent 40 bucks so he can make some vitamin D in his skin. So I have a very happy daughter with a very happy iguana, right? And you need both calcium and vitamin D for strong bones and healthy teeth, right? And when you do that, both my daughter and her iguana grew very well. And so you realize by now that here, case 3, 25-year-old female, poor dentition, osteoporosis, wrist fracture. 75 years old, you could probably make the DX, right? Because periodontitis is associated with vitamin D deficiency. And that, of course, is associated with heart disease and a lot of other issues as well. So I am an unusual consultant because I consult for most zoos in the United States because this is a major, major health issue for them. So vitamin D is rare in food. So if you like cod liver oil, in fact, the kids used to line up in the 40s and 50s because it tasted so good, right? We don't do this anymore, right? It comes in tablets, comes in oil, it comes in emulsion. And you realize by now that I'm a little bit controversial on my stance of sensible sun exposure. So typically the press are interviewing me and then they'll talk to a dermatologist. Dermatologist says, don't listen to this guy Holick, just eat more fish. Well, how much do you have to eat? Well, it's not a pretty sight, okay? Because I took my son to Guatemala here. We went sail fishing. I can tell you, there's no vitamin D in sailfish. No. It's oily fish, typically salmon. And how much is in there? No more than 500 to 1,000 units in a serving. So you would have to eat it every day to barely get enough vitamin D. But that's not the question to ask. We asked the question about a year ago, wild-caught salmon, where do they get their vitamin D from? They get it from the food chain. It's plentiful. Where do you think farm salmon get it from? They get it from the pelleted food that no one else would want to eat, and there's no vitamin D in it, essentially. So when we did an analysis of wild versus farm salmon and looked at their flesh for vitamin D content, there's essentially none. Only 10 to 25% compared to wild-caught salmon. So this is where you get your vitamin D from. It's from casual or not so casual exposure to sunlight. It provides most of us with our vitamin D requirement. Right? You're out there feeling great in the summertime. Look at this. Only about 0.1% of UVB ever reaches the Earth's surface at the equator, June at noontime. And looking at it from perspective, this is the amount of radiation coming into the Earth. And it's this tiny amount that was responsible for the evolution of vertebrates on this Earth. We've depended on it. And in fact, if you go and look at the meteorologic literature, it gives an insight to the problem. The ozone layer shows the rest of the solar system for Earth's harmful effects. In the summertime, the sun's rays are coming directly through the ozone, and about 0.1% UVB will get through, and you make vitamin D in your skin. But what about in the wintertime? The sun's rays are weaker, you wear more clothing. And so, in fact, the sun's rays are coming through more ozone. And the question is, are all of those photons being absorbed by the ozone layer so that maybe you can't make any vitamin D in your skin? So I got one of my students to go on a roof of our institution in the middle of the month on a cloudless day to measure how much you're making. And there he is, dutifully doing as I asked. And sure enough, look at this. In the spring, summer, and fall, you make lots of vitamin D. But in the wintertime, you can't make any at all. Well, when Cedric saw this data, he said, Holick, we are epidemiologists, we are evidence-based, we need evidence-based medicine, this test tube stuff on the roof is nice, but it ain't gonna cut it this day. So I said, look, I need a student to go up on the roof to prove to Cedric you can't make any vitamin D in your skin in the wintertime. After a lot of hemming and hawing, I finally got a volunteer. Tell you, Cedric, can't make any vitamin D in the wintertime in Boston, all right? Now, my daughter had the better part of this. She was at Middlebury College. If you go down to Miami for spring break, you can make it year-round. But guess at what latitude you basically cannot make any vitamin D in your skin from November through February. And if you live up in New York, it's probably from about mid-October through about mid-March to early April. Above Atlanta, Georgia, right? So 35 degrees. This is what we've been taught about the sun. And there's no question excessive exposure to anything is bad for you, including the sun. In fact, no question it will increase risk of non-melanoma skin cancer. Easy to detect and easy to treat if caught early. There's an evolution thinking about beachwear, and you've heard about this. Here in the 70s, 50s are the two-piece, 70s the one-piece, and now new millennium, as you've heard from Frank, was and from Ed is that they use lots of sunscreen, right? So we asked the question, if you put a sunscreen on, SPF of 15, how much does it reduce your ability to make vitamin D in your skin by? And it's by about 95 to 99%. And this is not rocket science, okay? Because SPF of 15, by definition, by the FDA, should be absorbing 95 to 99%, and therefore 95 to 99% reduction in vitamin D in your skin when you wear SPF 15 properly. So 90 to 95% of your vitamin D comes from sun exposure. How much? You never want to burn. You can't look like this. And coming from New England, of course, you can't look like that. Right, but early in evolution, we had the ability, we had a sunstat mechanism. We knew exactly how long to stay outside, go back into the shade so you wouldn't damage your skin. But we lost that ability about 10,000 years ago. But I reviewed the literature and got insight to the problem. It says here, how do you know when you make enough vitamin D? See these little puppies used to pop out of your belly button. That doesn't happen anymore, so we did a study. And we took some students and put them in our tanning bed or gave them an oral dose of vitamin D. And all the data that you hear out there about the 15 minutes, a couple of times a week, is really all based on mainly this type of data set. One minimal erythemal dose, a light pinkness to your skin, 24 hours after the exposure, so not a sunburn, is equivalent to ingesting between 10 and 20,000 units of vitamin D. So again, you can see that we're talking on orders of magnitude larger amounts of vitamin D than that 100 units in a glass of milk or 400 units in a multivitamin, that we really have missed the boat by an order of magnitude. So does sunlight provide you with your vitamin D requirement? You've heard this over and over again. No matter where you live on this globe, you have the highest blood levels of 25-hydroxy-D in the summer, and they're at their nadir at the end of the winter. So whether you like it or not, most of our vitamin D requirement, most of our basal level of 25-hydroxy-D is coming from sun exposure. Now, Mr. Burns here has a lot of worries, a lot of problems, and one of them is he's worried about aging affecting his ability to make vitamin D. Simpson's keeping up with the literature. We showed that if you're 70 years old, you have about a 70% reduced ability to make vitamin D in your skin compared to a 20-year-old, because 70 hydrocholesterol levels decrease with increasing age. So the obvious question is, can you make any at all? Should we be telling our elders to go outside? And we and Ian Reed did a study, and what we did was we took old biddies, wheeled them out on a veranda, and exposed them to sunlight. And sure enough, just 15 or 30 minutes, a couple of times a week, of just arms and legs was more than adequate to raise their blood level. Barney has a lot of worries and a lot of problems, and he had heard that obesity is associated with vitamin D deficiency. And indeed, when we took normal-weighted and obese individuals and either gave them an oral dose of vitamin D, 50,000 units of vitamin D2, or exposed them to simulated sunlight, we could show, on average, about a 50% reduction in their vitamin D levels. Why? Vitamin D is fat-soluble, and it does get into your body fat. And indeed, we wanted to know whether it was really there. So we took obese patients that were going for bariatric surgery, and I said, I need just 1 cc of your fat. Doc, don't worry about this. We'll give you some fat. And I can tell you that all of the fat biopsies that we've done to date, we find vitamin D. So I do believe that, in fact, body fat is a storage place for your vitamin D. In fact, obese patients probably need 2 to 3 times more vitamin D in order to be able to maintain their 25-hydroxy-vitamin D levels, and we believe that this is the mechanism. The obvious question is, what do you do after bariatric surgery and they've lost 100 pounds of fat with all that vitamin D? Are they going to mobilize and become intoxicated? The answer is no. Their 25-hydroxy-D levels do not go up, and in fact often go down, because as that fat is being destroyed, we believe that the vitamin D is being destroyed as well. So I typically recommend, that's where this recommendation is coming from about 10 a.m. to about 3 p.m. Because in the early morning or late afternoon, you basically can't make any vitamin D, even if the sun is shining in the summertime, because the zenith angle is too oblique, and you're still, like wintertime, going through too much ozone. So arms and legs a couple of times a week. And here in Copenhagen, that's exactly what they do. And indeed, go out there, enjoy yourself, then put the sunscreen on if you wish, or put some extra clothing on to prevent the damaging effects from excessive exposure to sunlight. Tigers are making a lot of money, so making a lot of vitamin D. We wondered about that because melanin is a wonderful natural sunscreen. So it's efficient in absorbing both UVA and UVB. And when we took our Caucasian and African American students, put them in our tanning bed and gave them the same dose, they didn't raise their blood level of vitamin D compared to the 60-fold increase in our Caucasian. They needed 5 to 10 times the exposure to barely raise their blood levels of vitamin D. These are vitamin D, not 25-hydroxy vitamin D. So Morgan should be concerned because you've heard over and over again, African Americans are at very high risk of vitamin D deficiency in the United States. More than probably 50% of African Americans throughout the year are vitamin D deficient in the United States. So vitamin D deficiency is misdiagnosed. Why? Because most docs have been looking at chem scans. They've been looking at the calcium. Calcium is normal. They are not thinking about vitamin D deficiency. But as soon as your ionized calcium goes down, there's a compensatory rise in your PTH, so you wind up with secondary hyperparathyroidism. So how do you know your D status? If you're heard over and over again, you want to order 25-hydroxy vitamin D. Don't ever order the active form of vitamin D. It's normal or elevated in a vitamin D deficient state. It's a barometer for vitamin D status. That normal range you've already heard over and over again was totally inadequate because we had assumed that you were all normal. We got the mean plus or minus 2 standard deviations, and that was what was considered a normal range. Half of you in this audience, I guarantee you, are vitamin D deficient. And as a result, that normal range couldn't be normal. But docs actually didn't care about the numbers anyway. They only cared about, it came back H, did it come back N, or did it come back L? Right? So at the end of the summer, I was always getting phone calls from my physician friends because they were getting their patients who were coming back from the Cape with an H. And they said, oh my God, my patient's vitamin D intoxicated, send them to Holick. I said, well, look, I see a lot of lifeguards, not so much here, the Baywatch babes. You may see them here in San Diego, but we don't see them in Massachusetts. They're probably over 100, as you've heard. Are they vitamin D intoxicated? No. Do they intoxicate men? Maybe sometimes, yes. De-intoxication, and I agree with Bob Heaney and others, we don't see de-intoxication till probably over 200 nanograms per ml. But just to be on the safe side, we like to keep the upper limit, at the moment at least, to be 100 nanograms per ml. So that lower limit is what we care about, and you've already heard from Bob Heaney that indeed we need to have it much higher. And I think that that 30 cutoff of 30 nanograms per ml to be vitamin D sufficient is a good one. So the adequate intake recommendations we've heard over and over again. Even the National Osteoporosis Foundation now comes out recommending 800 to 1,000 units for all adults. And so at a minimum, I think people should be on at least an additional 1,000 units of vitamin D a day with a multivitamin and probably having 2 courses of dairy that contain vitamin D as well. And so I think that the preferred range of 30 to 60 or 80 is really where we want to be. We don't want to be under 30, I think that's for sure. So is D deficiency a health problem? I mean, it's kind of incomprehensible with all of modern medicine, right? The cloning of the human genome. But sure enough, here in Boston, these are healthy elders, actually not so elder, they're over the age of 50, 25-hydroxy-D of less than 20, and these are at the end of the summertime. We also know here in Baltimore, 54% of the community dwellers over the age of 65 were found to be vitamin D deficient by Michael Gloth. Unrecognized epidemic in adults over the age of 50. Young adults, CDC, as you've heard already, 42% of African American women throughout the entire United States at the end of the winter, D deficient. We also did a study in our students and residents, right? Many of you never see the light of day, right? Working all the time. And sure enough, 32% were D deficient at the end of the winter. They were taking a multivitamin, eating salmon once a week, drinking 2 glasses of milk a day. 4% were students who remained D deficient at the end of the summer. What about in Bangor, Maine? Young white girls taking a Flintstone vitamin, 400 units of vitamin D, drinking 1 to 2 glasses of milk a day, working with Cliff Rosen and Sue Sullivan, we showed 48% were D deficient. So we followed them out to summer camp because they were out there exposed to a lot of sunlight, but they always wear sun protection. And sure enough, 17% came back still vitamin D deficient. Catherine Gordon showed at Children's Hospital, healthy adolescents, 52% throughout the year of Hispanic and African American boys and girls vitamin D deficient. Major issue in the sunniest areas of the world that avoid sun exposure. Up to 25% of the population have evidence of rickets. Vitamin D deficiency will not only precipitate and exacerbate osteoporosis, right, which is often a silent disease until you fracture, but causes this interesting bone disease, osteomalacia, which is not so silent. Symptoms are typically generalized bone pain, isolated bone pain, and muscle aches and pains. And typically, this is the diagnosis that they get, or chronic fatigue syndrome, or they're written off as having dysthymia, that they're depressed. 40 to 60% of these patients that are vitamin D deficient, if you correct their D deficiency within 6 months, often have significant improvement in their symptoms. In fact, here this 43-year-old black female shows up in my clinic standing in the corner crying. Her PCP had called me in advance and said, this woman's a nut. She said, why? Because she comes to my clinic standing in the corner crying because she can't sit down because her bones ache. And we did a mega workup, we did a bone scan, we did everything. There's absolutely nothing wrong with this woman. The one thing they didn't do was measure her vitamin D status. She was severely D deficient. Simply correcting that D deficiency and calcium deficiency, we raised her bone mineral density by almost 23% in a few years by just correcting her osteomalacia, by mineralizing the osteomalacia. Here, in Mayo Clinic proceedings, Plotnikov showed, and we're not talking about elders here, we're talking about young children as well as teenagers and young adults, ages 10 to 65 years of age, with bone and muscle aches and pains, showing up at a local Minnesota emergency room, 93% were D deficient. Here's a classic case of a 23-year-old female shows up in the emergency room with lumbar pain, given this wonderful diagnosis of dysthymia, being depressed, put on an NSAID and sent home. Asian female, same thing. This African-American male actually got a narcotic, sent home. They were all vitamin D deficient. 88% of Danish Arabs, I don't know so many Arabs up in Denmark, but apparently there are, complaining of muscle aches and pains, were vitamin D deficient. Now, I don't know what he's complaining about. He's constantly complaining about aches and pains in the bones and the muscles. The dog's fed up, telling him he's vitamin D deficient, right? Now, why do you get pain when you get osteomalacia? Well, you've all learned this in medical school. It's called the jello phenomenon, right? You take some jello, you put it in a bowl of water, what happens? It expands. That's what happens to the collagen matrix underneath your periosteum. It provides no structural support. So when you press down on it, they wince in pain. Or they have aching, throbbing bone pain. And indeed, I typically make the recommendation, if you press with a fair amount of pressure on sternum anterior tibia, and if they wince in pain, you don't have to ask them if they have pain, they wince in pain, it's likely to be periosteal bone discomfort and osteomalacia. This is a great story. 78-year-old male shows up with muscle weakness, atrophy, denervation, positive EMG, positive nerve conduction study for ALS. Turned out he was vitamin D deficient and all symptoms resolved. Here, insufficient link to Parkinson's disease. Recently, Vintam Preacher showed that there may be an association, which would not be a surprise to me. And we've also heard that even dementia that Bill Grant will be publishing is now being associated with vitamin D deficiency. So the higher your 25-hydroxy vitamin D level, better is your lower extremity function. Bischoff-Ferrari showed very nicely, again from NHANES 3 data. In fact, we've always known kids with rickets and vitamin D deficiency had severe muscle weakness. Now, I don't know if you ever wondered where Superman got his strength from, but you have a vitamin D receptor in your skeletal muscle. Right? So that's the reason. It was our son provided him with his vitamin D. Now, I also went on the internet because I wanted to see what Frank and Cedric were like when they were children growing up. And sure enough, they certainly appreciated vitamin D for muscle strength. All right, there's a positive association with your bone density from NHANES 3 again. Bischoff-Ferrari showed whether you're African-American, Mexican-American, or white, no matter what your ethnicity, the higher your 25-hydroxy vitamin D, higher is your bone density. Vitamin D and calcium prevents hip fractures in women. Chapuis showed in '92 reduction in both hip and non-vertebral fractures. Here, it was shown also by Bestos and Hughes, a similar study in both men and women. So we think if you get your blood level above 30, you increase your BMD, improve muscle strength, less likely to fall, less likely to fracture. But Women's Health Initiative, right? Does vitamin D and calcium prevent fractures, right? And the answer was, based on their data, no. But they had a slight problem with their study, right? Which was that they hated to take their calcium and vitamin D every day. In fact, 60% of the time they didn't. So guess what? What if you actually did? Well, they actually did a subset analysis of their data. And guess what? Women who took their calcium and vitamin D at least 80% of the time had a 29% reduced risk. That should have been the message from that study, right? All right, how do you treat D deficiency? Well, what you want to do, of course, you take a multivitamin. That's because you want to just get all your vitamins. But how many can you take? You only can take one, because A, you'll choke on these things, and B, you get too much vitamin A. Right? So when you go to the gas station, you get a gallon of gas. You might now, although it's actually less expensive these days, but you want to fill the tank. The D tank is on empty, and you need to fill it. And so what I typically do is I treat with 50,000 units of vitamin D2 once a week for 8 weeks. But you don't correct the cause. So the patient will come back 6 months later, they'll be D deficient again. So what do? This nice little green pill that we give them I give it to them 50,000 units once every 2 weeks forever. So the obvious issue is, because the PCP is saying, this guy Holick with the vitamin D, 50,000 units every other week, Mrs. Jones, you're going to build it up in your body fat, and you're going to wind up with vitamin D intoxication a couple of years later. Well, it turned out Einstein was worried about this as well, because he worried if you would be able to do this. So we looked back in our medical records, because I've been doing this for over a decade, and we showed, yep, the patients were D deficient. 50,000 units every 2 weeks for up to 6 years, that they were in the range of about 40 to 60 nanograms per ml. So it's very effective in maintaining blood levels. Now you also heard, and I think probably King heard this from Bob and also from Reinhold, that vitamin D2 is less effective than vitamin D3. And there's no question that if you give it in the way that they gave it, and here Reinhold gave 4,000 units of D2 or D3 in alcohol for just 2 weeks and showed about a 50% difference in 25-hydroxyvitamin D levels. And Bob gave a single dose of 50,000 units of D3 or D2 and demonstrated very nicely that maybe, in fact, D3 was in some way destroying, D2 was in some way destroying the 25-hydroxy-D3. But R2-D2 wasn't so thrilled because he didn't think he was any different than C3PO. And so who do you go to when you really have a problem? There's only one group, and that group, of course, is the Mythbusters. So we did a study, and what we did was to take healthy adults at the end of the winter, so they were not having any benefit from sun exposure. And we gave 1,000 units of D3 a day or 1,000 units of D2 a day for 3 months and looked at their 25-hydroxy-D levels, and we gave a group a placebo. 1,000 units of D3, 1,000 units of D2. No difference statistically in their blood levels. But then the question is, does D2 increase the destruction of D3? So at least at 1,000 units of D2 and 1,000 units of D3 a day, those that were getting 1,000 units of D2, their 25-hydroxyvitamin D3 levels did not change. But to leave no stone unturned, we also gave, because we worry about polymorphisms and how do you know with the 20 people or so that you're doing that maybe in the general population that the D2, D3 may interact with some people, we did a study where we gave one group 500 units of D2 plus 500 units of D3 compared to 1,000 units of D3. And as you can see, there was no difference. So at least in our hands for at least 3 months at 1,000 units a day, it seems to be equally effective. And giving 50,000 units twice a month seems to be effective in maintaining blood levels at where you want them to be for at least 6 years. But this is really the message. The message is if you want to be above 30 and you're in the wintertime, most are starting at around 18 nanograms per ml, 1,000 units a day. Not one of our healthy adults were above 30 nanograms per ml. In fact, that's the more important message from the study. 1,000 units a day with no other vitamin D intake will not raise your blood level above what we consider to be sufficient. So no one was sufficient.
I gotta say, this one is totally busted.
Total. It's busted.
Got it? All right. So, but this is, as you've heard already, because whenever I talk to physicians, this is the one thing that they remember more from medical school than anything else, right? Don't ever make your patient vitamin D intoxicated. They've never seen vitamin D intoxication. They don't even know what vitamin D intoxication is. But docs know 50,000 units of vitamin D twice a month is going to cause vitamin D intoxication. And in fact, what you will see with D intoxication is hypercalcemia, hyperphosphatemia, and a markedly elevated level of 20-hydroxy-D, usually above 250 to 300 nanograms per ml. And Veith showed very nicely, you could take up to 10,000 units a day, and Bob showed this very nicely in his data set, and you will not cause vitamin D intoxication. So you really have to be taking a large amount of vitamin D before you have to worry about this issue. Now, my son wanted to be a lawyer, and I went on the internet to get these little ditties to keep him on the straight and honest path, and this is my favorite. Here's Satan talking to his underling. It says here, it's kind of chilly, throw another lawyer on the fire. 7 o'clock one morning, I get a phone call from a lawyer in Florida, and he says, "Are you Dr. Holick?" And I said, "No." I was interested in talking to a lawyer at 7 o'clock in the morning. He said, "I know you're Holick because you're the only one there early in the morning." I said, "Okay." He said, "Well, I'm going to sue you because I've been following your advice." And I said, "What do you mean?" He said, "Well, back a decade ago, you could not go to your local drugstore and find a vitamin D supplement. They didn't exist, but they were already on the internet." And he went on the internet and bought this from this Canadian company, Pro Longevity, 1,000 units in a teaspoon. And he had heard 2 teaspoons a day, 2,000 units a day would prevent prostate cancer. So he was taking 2 teaspoons a day. He showed up in his local emergency room with severe vitamin D intoxication. Followed my advice, he's intoxicated, he's going to sue me. I said, "Okay, before you sue me, send the stuff up, we'll do an analysis for you." We did. The company forgot to dilute it. He was taking over 1 million units a day. And so this guy was vitamin D intoxicated. In fact, we published him in the New England Journal of Medicine. He had a calcium of 15, 20-hydroxy-D of 500. This is vitamin D intoxication. But there's another message here. Okay, A, he's a lawyer. So what does he do now? He calls me up and he says, I want you to be my physician. So I said to him, okay, so what do you do for detoxification? If you read the textbooks, right, it said to give glucocorticoids. Well, I wasn't about to give a lawyer a glucocorticoid, right, because it guaranteed he was going to have complications. We paid him some Lasix, we hydrated him, and I told him, avoid sun exposure without sunscreen and don't take any vitamin D. We brought his blood level of calcium down almost immediately within a month or two, and his 25-oxy vitamin D level was still at around 300 nanograms per ml, right? And he was not vitamin D intoxicated any longer. So you can really get that blood level up quite high, but probably above about 300 to 350, you need to begin to worry. It's difficult to become vitamin D intoxicated, okay? So who's at risk? I think I've convinced you that everyone is. But there is a small group out there, unenlightened dermatologists in particular, that say, why should you care? Well, this is why you should care. We were born. We evolved in sunlight. And as you've heard, once you get vitamin D from your skin or your diet, it has to get activated in your kidneys. And we now know, of course, that every cell in your body has a vitamin D receptor. Why would they be there if they weren't having a biologic effect? We know that it regulates calcium metabolism. So what are those other functions? Well, the first insight was really Suda back in 1979 when he took leukemic cells, incubated them with active vitamin D that had vitamin D receptors, and showed that they became normal. So this led, of course, to this vitamin D and cancer connection, which you've heard a lot about from Cedric already, so I'm not going to bore you with any of those details. But he got a lot of press in here. Sunbathing could cut your risk of cancer. I'm sure he remembers that from over a decade ago and was ridiculed by most of the scientific community. So there is, though, I think, good evidence now that sunlight deficiency and vitamin D deficiency is associated with it. But in 1983, I was asking a different question. I was curious to know, why is it that not only can your skin make vitamin D, but that your skin had a receptor for vitamin D? And so we began pursuing this. And since the keratinocytes had a receptor when we incubated them with active vitamin D, and I collaborated with my very good friend, Dr. Barbara Gilchrist, who was a dermatologist and good friend, we showed that 125D was one of the most potent inhibitors of proliferation and most potent stimulators of differentiation of cultured human skin cells. Well, that's nice for the poor medical student has to memorize some more biochemistry, for taking their boards. But the question was there a practical benefit? So I put my MD hat back on and asked the question, what hyperproliferative skin disorder is out there that is not malignant that you could potentially use activated vitamin D and its anti-proliferative activity? And of course, psoriasis was the obvious connection. In fact, psoriasis, the skin cells multiply, your epidermal cells multiply 10 times faster than normal. So we asked a simple question, is it both useful and safe? Topical administration, all sounds really nice on paper, but what do you do? Well, we were never taught in medical school, right, how to formulate anything. And so I went back into the lab, and I'm an organic chemist, and so, in fact, when I was with Hector DeLuca, we were the first to chemically make 125-dihydroxyvitamin D, so I actually had some that we had made previously. And I found some Vaseline on the shelf, so I figured, what the heck? But how do you put in Vaseline? Well, what you do is you warm it up. So we warmed it up, got it to 50 degrees, and it melts. So I put the 125D in, scooped it around. I sent to the FDA saying I wanted to do a study. I got an IND within about 2 weeks. Can't do that anymore, but back then you could. And so we did a double-blind placebo-controlled trial. Now, I went to my dermatology friends and I said, you know what, I need some patients with psoriasis. I think this is a really neat idea. In fact, I used to go to NIH with the study section, and people would carry their pictures of their family. I'd be carrying pictures of my patients with psoriasis showing that we were really having some definite benefit. So the dermatologists, they said, we really don't have any patients for you. So they decided in the end, because I kept bugging them, why not send Holick? Just like they did here for Mikey's cereal, we'll send him the worst patients that don't respond to anything, right? He won't have any success. He'll stop bothering us and give up on this idea of using activated vitamin D to treat psoriasis. So here's this guy, shows up, 8 years, had no effective treatment for his psoriasis. I gave him 2 tubes, one with, one without. I didn't know, he didn't know. And sure enough, he came back 3 months later. I'm not a dermatologist, okay, but I can tell you, it looked to me like maybe there was a response, okay? And histologically, look at this. This is the placebo side, and this is the side that received 125D. Marked restoration of proliferation and differentiation. And so here, scalp psoriasis, the same thing. You can't get this at this dose, by the way, because it's the same business in the derm field as it is in the medical field. They worry that it's too toxic. So what do? They put a sub-effective dose in all the preparations that are out there, and that's why it's only semi-effective, okay? But in my experience, at the dose that we were giving, that it was approved by the FDA, 92% improved and 65% cleared. There are no other data out there that match this, and it's mainly because they use 3 micrograms, not 15 micrograms per gram base. That's what Galderma is using for their product that's in Europe and soon to be released in the United States. So what do you do when you get really exciting data? Only one place to go, New England Journal of Medicine, right? So that's what we did. And of course it was rejected. So I knew I was on the right track. All right. And so I went to a derm meeting. So I kept sending our stuff to the derm meetings, and of course they keep rejecting it. And so finally they put me on Friday afternoon, 4 o'clock, as a poster, and they finally said, okay, we'll give you an oral presentation. So I finally was giving oral, and there was nobody in the audience. But there were a couple of people, and one was the Boston Globe, and they said, are you interested in some patients? I said, as a human interest story, we'll write it up in the paper. How would you like that? I said, that'd be great. So sure enough, help for psoriasis, call Holick. That's when I was at Tufts University. And so guess what? About 6 months later, so I was getting a phone call once every couple of weeks. I'm getting a few psoriasis patients. I'm really thrilled. About 6 months later, the phone's ringing off the hook. And I'm starting to answer the phone. Every 5 seconds, the phone is ringing. I said, my God, where'd you hear about this? Do you read the Globe? They said, of course we read the Globe. Well, it wasn't the Boston Globe, it was the Globe, right? The second most read tabloid. And here next to Dynasty was Psoriasis Hope, call Holick, right? Well, this, of course, fit what the dermatologist thought of me, but then we made, of course, the Inquirer. So next to the Crazed Knife Man, breakthrough for psoriasis, call Holick. Well, not to look a gift horse in the mouth, they put on an answering machine, and I wound up with 20,000 people writing to me. I have the largest psoriasis patient population of any dermatologist in the United States. And so don't worry about New England Journal of Medicine, Science, and Nature. No, no, no. Globe Inquirer, that's where you want to publish. Right, Cedric? Yeah. All right. And so it is first-line treatment for psoriasis. It's reasonably safe and effective. Now, Bill Grant, of course, has been promoting not only vitamin D, but solar ultraviolet radiation. And he showed, with Cedric and others, that if you have more sun exposure throughout your life, you're less likely to die. We also know, because I got all my students to just take a look at the database in California, just for the heck of it. And sure enough, if you live in San Diego, you are less likely to develop colorectal cancer than if you live at a higher latitude in California, i.e. in San Francisco. Also, we know now from Luscombe, this was published in Lancet, men typically get prostate cancer about the age of 52. Men that worked indoors, on average, got prostate cancer at around the age of 52. But men that worked outdoors had a 3 to 5 year hiatus before they developed prostate cancer. And recently, Knight published that young girls exposed to the most sunlight during their teenage years and young adult years reduced their risk of developing breast cancer by more than 50%. But WHI, right, $600 million boondoggle, right, concluded that vitamin D and calcium did not cut risk of colorectal cancer. Well, when we saw this, called up Cedric. Well, it turns out Cedric was kind of hiding under the table because he had informed me that he was a co-author on this. But he said, we need to look at the data, which we did. And when we looked at the data, yeah, it doesn't look like there's any benefit. But they didn't look at their data correctly. Because look at this. Most of those women were D deficient. So what if you take a woman that's D deficient, follow them for 8 years in a D deficient state? And that's what Cedric and I did, and published in New England Journal a letter showing a 253% increased risk of colorectal cancer. Very consistent with what Bob Heaney and Lappy have been reporting just after 4 years of increasing their vitamin D intake to 1,100 units of vitamin D a day, reduced risk of all cancers by 60 to 77%. So what's the possible connection between vitamin D and cancer? Well, activated vitamin D inhibits cancer cell growth. We know that. But what's interesting is that no matter how much vitamin D you ingest, no matter how much sun exposure you have, your kidneys will not make more activated vitamin D because it's a major regulator of calcium metabolism. It tightly regulates it, and PTH is one of the major players. In fact, your blood levels of 125D are often elevated in the wintertime, which of course doesn't make any sense. So it's a real conundrum. And so what are the possibilities? Well, it was Gary Schwartz who really began thinking about this and realized that maybe, in fact, there's an autocrine-paracrine system, and that maybe many of the cells in the body have the enzymatic machinery to do this. And sure enough, there's some evidence now that maybe up to 2,000 different genes may be regulated by 125D, produced locally within tissues. What about the immune system? We know that activated T and B lymphocytes wind up developing receptors, and so you can regulate cytokine production and immunoglobulin production. And we also know from Camargo's work that maternal intake of vitamin D was associated with a reduced risk of having their children have wheezing diseases by as much as 61%. He's gone on to show also that if you look at asthma, that there's no impact apparently on vitamin D compared to looking at wheezing diseases in these children. And there's also evidence that eczema may be affected as well. We know that macrophages activate vitamin D, but we've never understood why. But we now know why. Vitamin D in cod liver oil protects against TB because it was Liu, Adams, and Wadlin that showed that when you infect a macrophage, you activate the toll-like receptors. Guess what gene gets turned on? The 1-hydroxylase to make 125D to tell the cell to make cathelicidin, a defensin protein that specifically kills infective agents. So we're now beginning to realize why solariums were probably effective and why African Americans are at a higher risk of getting TB. So local production of 125D is important for innate immunity. And there's some evidence, and this was John Cannell who started resurrecting this concept of this Hope-Simpson phenomena, seasonal stimulus, that we get flu-like symptoms in the wintertime, not in the summertime, unless you live at the equator. And so the thinking was that maybe this was due to D deficiency in the wintertime. And sure enough, it was shown by a lawyer that women taking 2,000 units of vitamin D a day reduced their risk of getting upper respiratory tract infections by about 90%. Multiple sclerosis, a clear association, as well as for rheumatoid arthritis, about the same effect. We also know osteoarthritis is associated as well. And you've also heard about the fact that you will live longer if you have adequate vitamin D on board. And so finally, we think it is important to have adequate vitamin D from birth until death. And of course, D deficiency is a disease of neglect. And there's a mountain of evidence linking it to many chronic illnesses. And don't think about a normal level, but a healthy level. And that healthy level is certainly greater than 30. We also know, and you've heard this from Bob and from others, that for every 100 units you ingest, you raise your blood level of 25-hydroxy-D by 1. And so if you're at this range, 1,000 units is not going to do it. And even in sunny Florida, vitamin D deficiency is a common problem. And early in the morning and late afternoon, it may be great for romance, but you will not make any vitamin D in your skin because of that zenith angle. So adults and children at a minimum should be on 1,000 units of vitamin D a day, along probably with a multivitamin containing 400 units. And you want to conquer D deficiency, and the best source, Bond bread, thought would be great. You didn't want your kids naked outside every day, eat vitamin D fortified Bond bread, right? Time magazine, if you wanted to get your vitamin D and you're an adult, drink vitamin D fortified Schlitz beer and keep sun energy all winter long. What about tanning? We also know that maybe there is some benefit to tanning if you do it properly, because we went out to show that if you look at bone density in tanners compared to non-tanners in Boston, and non-tanners were all vitamin D deficient, tanners exposed just once a week, blood levels of 48 nanograms per ml on average, that they had higher bone density, consistent again with the NHANES 3 data. And so Johnny Espada Sunshine, play in it, get your vitamin D. We've always appreciated the beneficial effects of the sun. And so how do you get the message out? I wrote a book called The UV Advantage. So I don't advocate tanning, right? But those who wish to do should do it responsibly. And we've already heard that excessive exposure to sunlight increases your risk of squamous cell carcinoma. But melanoma, you've already heard about, right? People should avoid all sun exposure. But most melanomas occur on the least sun-exposed areas. Occupational sun exposure decreases your risk of malignant melanoma. In fact, Kennedy reported that, yes, by contrast, lifetime sun exposure is associated with a lower risk of malignant melanoma. Washington Post picked it up. We're finally getting that message out. Health Benefits, ancestors have always appreciated. Dermatologist view is a little bit different, right? Gilchrist, remember her, my close personal friend, right? She calls me, and 2000, and she nominates me for the Psoriasis Research Award, but 2 years later, she winds up firing me because she says that Holick resigned after it became clear his message was doing a disservice to the field and the public. She termed the evidence of an epidemic of D deficiency weak and absurd and linking it to medical illness as schlock science. My chief of medicine, a cardiologist, comes to me and says, Holick, I need you to put on your website you don't advocate tanning. I said, I already do. We'll do it again, fine. And then he said, I'm going to have to defend your position in front of the entire department, with the entire department of dermatology, with Dr. Gilchrist in the audience. Good luck. So I said, you know what, Barbara, you really don't know a person until you Google them. So I Googled Gilchrist. I came up with this. I knew this couldn't be her. She's too tan, right? No, this is Nicole. I Googled her, and she came up with this. She's a little pasty looking because it's what being head of dermatology, right? And so I pointed out, this is probably what she wanted to do to me, right? Okay, I told her, this is not a new treatment for osteoporosis. No, this is the Inquisition. They weren't nice to Copernicus. In fact, I pointed out something. You know what? Inquisitors, they were never exposed to any sunlight. They're probably pre-AKA dermatologist, right? Galileo here, he wasn't treated well, taken in front of the tribunal, and of course we know the rest of the story. You know what schlock science, I didn't know what schlock science was, right? I Googled schlock science, came up with this. That's what these two schlock scientists, right, back in the 80s thought was responsible for peptic ulcer disease. And we know the rest of the story, right? Dermatologists advising you about wearing sunscreen. Always wear it, right? Have you been on rounds with an online dermatologist? The kinder, gentler view in life, and Schultz epitomizes this in his penis character. Says here, are you sitting in the sun? This is in San Diego, right? A little sun is good, as long as you don't overdo it, perhaps 10 minutes a day. This time of the year is about right. He was right on target. All right? It turns out that this is what we should be thinking about. It's moderation is what we need. This is what's happened to our sun. It's been demonized for more than 40 years, right? Sun exposure and melanoma, you've already heard. The more sun exposure you have, the more likely you're to survive melanoma. The more sun exposure you have, less likely to have Hodgkin's and non-Hodgkin's lymphoma. 30% to 50% of Australians are now vitamin D deficient, right? And they're now recommending adequate sun exposure to make enough vitamin D and prevent damaging effects. And there it is, it's free. Very few things in life are free. Are you always indoors all the time? Are you D deficient? What do? I follow my own advice. I love to cycle, sunscreen on face, but not on arms and legs. I take 1,000 units of vitamin D a day, drink 2 to 3 glasses of milk a day, and my blood levels on average about 50 nanograms per ml. D deficiency is probably the most common medical condition in the world. And as I pointed out in New England Journal Review, even if one of these chronic diseases is associated with D deficiency, all the more reason to increase our vitamin D intake. There is no downside to increasing your vitamin D intake. In fact, you don't need to be a genius to know that we need sensible sun and vitamin D recommendations. And if you do that, and this may be the theme song, thank you for your kind attention.